Uh, Thank you all for coming. I'm Dan Whitaker, and along with my co-author Shannon Self-Brown, I run the National Safe Care Training and Research Center. Safe Care is an evidence-based parenting program that we own and disseminate. We've been doing it for about 10 years, and this talk is really about how to use technology to enhance its dissemination and effectiveness. And I use the term technology loosely. So the goals for the talk are, one is to provide a rationale to you for using technology for data collection and reporting. Second, to talk about how we can use data to tweak interventions and examine their effectiveness. And third is to show you some of the features that we've been building in an app and a web portal that we hope will do this. So who's heard this? Who's heard, well, we adopted an evidence-based program, so we don't have to worry about collecting data. Or we already know our program will be effective because we're using a program that we know is effective. Well, this is wrong. Doing an evidence-based practice actually means using data in your practice. You can see this in implementation model. So this is Dean Fixon's core implementation components. There are 6 of them, and 2 of them are about evaluation. So we have staff evaluation, understanding how your staff are doing with the model. Are they adhering to it? And the second is program evaluation. So how are your families doing? Are they showing behavioral skill uptake? Again, another support for this is the report of the AppSAC Task Force on Evidence-Based Service Planning. This is by Lucy Berliner and crew. One of the things they recommended was periodic screening and assessment and development of efficient feedback systems to ensure progress monitoring to optimize outcomes. So the question is, why don't we use data? There are lots of reasons, but these are the 3 I came up with. First of all, we lack easy-to-use systems for getting data in and out. We can't add more paperwork. If there's one way to piss off a caseworker, it's to give them more paperwork. Secondly, habit. I think people are not used to using data, particularly program managers, and the third one I'll get to later. The goal here was to build a data system for sites that could improve their implementation and evaluation. We wanted to make it easy to use, little additional work, and ultimately informative, which is, I think, going to be the biggest challenge. So let me divert for a minute and tell you a little bit about Safe Care. Safe Care is a behavioral parenting program for child abuse and neglect. It's for parents of kids age 0 to 5. We focus on 3 things: parenting, home safety, and child health. It's behavioral, so we do behavioral observations, which are key to looking at understanding change. And so far, we've disseminated Safe Care in 26 states and 7 non-US countries. Now, the structure of each of the Safe Care modules is the same. We start out with an assessment before we do skill training, and we end with an assessment. So the goal is for the provider to be able to see the change that they're on the skills that they're training. And so, the question is, can we use these observations to help providers understand when they are and are not having an impact on a broad scale? So our challenge here was to build an efficient and effective data collection system that could yield useful and intelligible information. And the third box is to providers, directors, and system leaders. So what this means is we need different information for different people. Finally, we know that the availability of data does not mean people will use it. So what are we building? Here's the loose definition of technology. We're building an app for use with our program. This will assist with data collection. And really our goal was to have people enter data into an app that they're already collecting anyway. And now we have a web portal that's been in existence for a while. This tracks our trainees, we track fidelity, and now we're going to be reporting on family outcomes. And so the app is used to collect a variety of family information, a little bit about demographics. We input those skill assessments that the providers do. We get families to rate engagement each session, so maybe we can see dropout coming. They rate satisfaction with the model. And we also do fidelity capture via audio recording. And so here's a screen from our app. You can see some of the features there. We only use initials so we don't get identifying information. We have a case number so that can be matched to sites' own databases. We have some demographics forms, and we have the pieces of Safe Care that the provider would select. We also have a slot for non-Safe Care sessions for sites who want to track that stuff. I think there's going to be, yeah, here we go. This is our parenting module. Again, where are you going? Just some of the features of it. But essentially, this is everything the providers will need to do during the parenting module. And some of the features, we have an engagement form, like I was saying. Sorry, I didn't realize the animation was coming. What are we looking at on individual level for reporting? Well, a couple of things. This is for a provider. They'll be able to see the summary of case characteristics, as the session's completed and program completion for a family. We're hoping to look at when people are dropping out and push out notifications for flagging families who may be at risk. They'll be able to see behavior changes and so on. At the program level, what we're trying to look at is more broadly, how are providers doing with regard to, are they serving their families, or do we see differences between providers in completion rates and timings of dropouts, and behavior changes, behavioral skill uptake between providers and by demographics. Here's an example of one of the reports from our portal. What you can see is we got client summary information at the top. We've got the behavior change metrics. You can see the middle panel is the safety measure. The family hasn't done that yet. And then we've got satisfaction ratings from the clients. So I wish I had time for more examples, but I don't. So some of the challenges, one is just the utilization of the app. Can we get people to use it? We've pilot tested this, and it's gone remarkably well. Secondly is looking at the data. This is a big one. What TA is going to be needed to help people understand these reports? A few other challenges are coming in a second. Actionable information. So it's hard enough to know, based on a scientific study, what to do with a program. Should we implement it? Do we need to tweak it? How do we do that on this level when we're dealing with few clients and with non-research data? And the last is integration of data systems. We really need to help sites avoid double data entry. That would be a death blow to this. The next steps, one is to finish this damn thing. We've been working on it for years, and we're almost there. We need to do some revisions and reporting screens. We want to pilot test it, and then there's going to be a very broad rollout. We have well over 100 sites doing safe care, and that should be fun. Finally, we want to look for a grant to examine the utilization and the impact of this on family outcomes. Thanks.